I'll be doing the medial palpations. So right here, we have the medial tibial plateau. Right here is the tibial tuberosity, and we'll move medially, and that'll be the pes anzarine. Up here on the femur, we'll have the medial femoral condyle. If we go up superiorly, it'll be the medial femoral epicondyle, and up more superiorly will be the adductor tubercle. Now I'll be palpating the meniscal window and the joint line. So we're gonna find the patella tendon, and we're gonna go medially, and we'll feel like a little depression. And from there, we'll go more laterally, and we'll feel the joint line. From the joint line, we'll palpate inferiorly, we'll feel the tibial plateau. And so we go back to the joint line, we'll go superiorly, where we feel the femoral condyle, medial femoral condyle. And from there, we'll palpate more superiorly, and it'll be the medial epicondyle. So now I'll be palpating the tibial tuberosity and the pes anzarine. So from the patella tendon, we'll move inferiorly until we feel a bony prominence, and that'll be the tibial tuberosity. From the tibial tuberosity, we'll go medially until we feel another bony prominence, and that'll be the pes anzarine. Now I'll be showing you the medial collateral ligament. The medial collateral ligament is not palpable unless you have a sprain, but it should run from the epicondyle to the tibia. Now I'll be palpating the medial meniscus. So first I'll find the joint line, and I'll ask him to internally rotate his tibia, and I will feel the soft prominence poking out, and that's the medial meniscus.
So now we're going to palpate the patella. So the patella is commonly known as the kneecap, so you'll feel a bony prominence. You can have him kick, and it's also known as the largest sesamoid bone. Okay, from there we're going to palpate the patella tendon. So from the patella, just the bony prominence, you run inferiorly, and it attaches to the tibial tuberosity, which is right here. Next, the quadricep tendon runs from the end of the quadricep muscle to the superior portion of the patella. So all along here, just about right here.
Alright, today I'll be starting lateral palpations. We're going to start with the common peroneal nerve. To find that, you're just going to palpate across the neck of the fibular head, and that's where it's going to be.
Okay, so now we're going to palpate the lateral tibial plateau. So to start, have your patient supine and with the flexed or bent knee. And from here, we're going to place our fingers in the popliteal space, and then we're going to then place our thumbs in the depressions right here, or the meniscal windows. From there, we're going to palpate inferiorly, and around here on the lateral side, you'll find that tibial plateau. From there, if you palpate inferiorly, you'll feel bony prominence, and that will be your lateral tubercle. Start with your fingers in the popliteal space. From here, place your thumbs in the depression, and from there, move laterally and superiorly until you feel a bony prominence, and that's your lateral condyle. From here, move slightly more superiorly, and you'll feel the lateral epicondyle.
Alright, so to find the head of the fibula, we're going to find the tibial tuberosity, and we're going to move just laterally. And it'll be that bony prominence. So for the lateral meniscus, we're going to have the patient's knee bent, and we are going to palpate the lateral joint space, and you may be able to feel the lateral meniscus. Alright, so for the lateral collateral ligament, we're going to have the patient's knee flexed at 90 degrees. It's going to be abducted, and it's going to be internally rotated. The lateral collateral ligament is going to run from the lateral epicondyle into the fibular head. Palpating the bicep femoris tendon, that is going to attach at the fibular head. It becomes more prominent when the patient's knee is flexed at 90 and they resist knee flexion. It'll be right there. Now we will be palpating the IT band. Have the patient seated, knee flexed at 90 degrees. You're going to have the patient dig the heel into the ground, and that will make the IT band more prominent.